Let's take this issue on now. We can speak to Shadim Hussain, who's a British government advisor and also a board member of the Bradford Foundation Trust, joins us on Skype from Bradford in the United Kingdom. Mr. Hussain, welcome to the programme. It's evident, isn't it, the coronavirus has thrown into sharp focus just how vulnerable ethnic minorities are around the world.
Hi, Nikki. Thanks for having me. Yeah, absolutely. I mean, some stark information coming out of the USA. We're seeing some similar data here in the UK, and as myself and other commentators had mentioned quite early on, that there is a significant risk to minority communities from COVID-19.
Yeah, and if you just look at those figures, the New York figures particularly, 34% fatalities are Hispanic, 28% are black, and 27% are white. Should we therefore, in places like the United Kingdom and the United States, where things are approaching or are at their peak, be especially aware of this? Is there anything that we can do now?
You know, I think, there was some early missed opportunities. If you look at the government communication, which we have the daily briefing, it's always done in English and only in English. And there hasn't been any translation or any multi-languages provision. Got to bear in mind that the UK has a significant minority population, and a good proportion of them, for them, English is not their first language. We also have a sizable refugee population who speak many different languages. So communications is a very important thing. I think at this stage, it seems like, given the number of deaths reported, I think over 1,000 in the last 24 hours, we're heading somewhere towards the peak. And it's very important that we reinforce these messages and ensure that minority communities are educated about these risk factors as well.
And now this has been thrown up into sharp focus. What does it say about the future? What can we do for the future? How can we ensure that these vulnerable communities are not at risk like they are right now?
Well, I mean, there was some positive news today from the Chancellor just earlier. She announced £750 million for charities, and £350 million of that is allocated towards small charities. And I think it's very important that at this stage, we back and support those minority organisations who are in a position where they can support this. The reality is that there's not very many organisations that are in a position nationally that can support local communities. And this is a very important thing, that we ensure that, local charities who have a grasp on their local communities, those who offer faith and culturally sensitive services, are given the support that they need. A very important factor in this is the impact that it's going to have on the mental state of those people who are affected by this, deaths in the family. Currently, there's issues around being able to attend hospitals. So loved ones are being led to dying on their own. There's restrictions around attending funerals. We know that people of faith communities and those of BME communities, there's certain traditions and rituals about the way that we practice our faith and the way that we follow through in death, and these are a real impact on those societies and those communities.
Right. Is this vulnerability something that we knew about before coronavirus, but it's just only being talked about now because of what's happening?
Well, I mean, we know, Nikki, that, BME communities and minority communities live in some of the worst socioeconomic and health outcomes from many minority countries, and there is a higher infection death rate. We've seen from the other countries, such as Italy and Spain in particular, that those with underlying health issues, those over the age of 60, are particularly at risk. One of the factors we know with South Asian communities, for example, in the UK, is very many of us live in intergenerational families. And that poses real risks, where you've got 3 generations living in a household, and the younger generations may not feel the same pressure, given the statistics and the data that's come out that COVID would pose a risk to them. But they inadvertently have a risk factor to the rest of their family members, in particularly their parents and potentially their grandparents who may be living in the same household.
So, Shadim, it's just great to get your perspective on this. I do appreciate that. That's Shadim Hussain there talking to us from Bradford in England.
Thank you, Nikki.